10 early signs of a heart attack. Imagine a typical day full of activities and responsibilities. During this routine, subtle warning signs may quietly appear that indicate a silent heart attack. Contrary to the dramatic images often seen in the media, a silent heart attack can present with mild symptoms that are easily overlooked. Recognizing these early symptoms is crucial for timely intervention and preventing severe heart damage. Let's delve into the world of silent heart attacks and explore 10 early warning signs, risk factors, diagnostic tests, and preventative measures that can help you take steps to improve your heart health. On a sunny afternoon, you are out for a walk. Suddenly, you feel a strange discomfort in your chest, but it is so mild that you interpret it as indigestion. Over the next few days, even after a full night's sleep, you find yourself unusually tired and attribute it to work-related stress. During an important work meeting, you feel short of breath, almost as if the room is closing on you. You think it's because of the air conditioning failure. The next day, you feel lightheaded when you stand up, but you ignore it and blame yourself for getting up too quickly. Weeks go by and you feel a slight pain in your jaw and neck, but you attribute it to your poor sleeping position. Your ankles swell and you wonder why, thinking it's because you're on your feet all day. You also notice you have no appetite, experience sudden awakenings in the middle of the night while drenched in sweat, and your heart is beating fast. You convince yourself with excuses, but your heart is smart and tells your body something is wrong. A heart attack occurs when plaque in the coronary arteries, usually formed due to the accumulation of fatty deposits, ruptures and causes blood platelets to stick to that area, forming clots. If this clot gets big enough, it can block the artery and prevent blood from reaching parts of the heart muscle. Without oxygen, the damaged heart muscle begins to die, leading to a heart attack. Immediate medical intervention is necessary to restore blood flow and minimize damage. People with diabetes, high blood pressure, and high cholesterol are at significant risk because of the damage these conditions cause to the arteries. Smokers and people with a sedentary lifestyle, poor diet, or obesity are also at high risk. Age is a critical factor, with increased risk for men over 45 and women over 55. In addition, those with a family history of heart disease are more susceptible. Chronic stress, excessive alcohol consumption, and pre-existing cardiovascular disease are other factors that increase the risk of a heart attack. An electrocardiogram (ECG) records the heart's electrical activity and can show abnormalities that indicate a heart attack. Blood tests measure the levels of cardiac enzymes, such as troponin, released when the heart muscle is damaged. Echocardiography uses ultrasound to evaluate heart function and identify damaged areas. Coronary angiography involves injecting dye into the coronary arteries and taking X-ray images to detect blockages. An MRI or CT scan of the heart also provides detailed images, highlighting areas of reduced blood flow or muscle damage. These tests, often used together, confirm a heart attack and guide treatment decisions. And now we come to the symptoms of a heart attack. Imagine waking up after a full night's sleep, only to find yourself still exhausted. This isn't your typical tiredness. It's a persistent fatigue that doesn't go away no matter how much rest you get. Your heart might struggle to pump blood efficiently, leading to poor circulation and reduced oxygen supply to your tissues. Picture yourself sitting at dinner, and suddenly you feel a mild pain or pressure in your chest. So subtle you might think it's just indigestion. This discomfort can come and go, feeling like squeezing, fullness, or a burning sensation, and it shouldn't be ignored. You're walking to the mailbox and suddenly find yourself gasping for air. This shortness of breath, especially when resting or doing light activity, can be a sign that your heart isn't pumping blood effectively. Even without chest pain, this symptom is significant. Standing up quickly, you feel a wave of dizziness wash over you. This isn't just from getting up too fast. Frequent dizziness or feeling faint can indicate reduced blood flow to the brain, hinting at heart problems. You're chatting on the phone and notice a nagging pain in your jaw and neck. It's easy to chalk it up to muscle strain or dental issues, but this pain can be an early sign of heart trouble, especially if it comes with other symptoms. After a day on your feet, you notice your ankles are swollen. This isn't just from standing too long. Heart failure can cause fluid retention, leading to swelling in the ankles, feet, or legs due to the heart's poor pumping function. You wake up in the middle of the night drenched in sweat. There's no apparent reason for it, and it happens frequently. These night sweats can be a red flag, indicating the body's stress response to heart strain. Your heart suddenly feels like it's fluttering or pounding. These episodes of a fast or irregular heartbeat, known as palpitations, can signal an arrhythmia, sometimes accompanying silent heart attacks. Food suddenly seems unappealing, and you feel full quickly. This loss of appetite can be a sign of a heart attack, possibly due to fluid buildup around the liver and intestines, causing nausea and discomfort. A persistent sense of anxiety or a feeling of impending doom can be alarming, especially when there's no clear reason for it. This anxiety can signal an impending heart attack, as stress hormones impact heart function and exacerbate cardiovascular issues. Thanks for watching, and if you found this video useful, don't forget to subscribe for more health tips and information.